Guys, my name is Daniel Torres. I am a part of Group 5 with Manjot, Hadar, Emily, Yessi, and Will. We are going to be going over gait training patterns, which will be in the series, the series of 4-point, 2-point, 3-point non-weight bearing, modified 3-point, 50% partial weight bearing, touchdown weight bearing, and this is with appropriate assisted devices. We are going to be basically assuming that the patient or our audience here has prior knowledge to assisted device use. So with that, we want to make sure that we are obviously making sure that the patient has proper core stability, they have upper body strength and or lower extremity strength on the non-affected area or non-affected side. When it comes to gait training, we want to make sure that the patient is always able to be alert and aware of their surroundings. Obviously, we want to know that the gait and assisted devices are what is helping us become more independent. With those independence, we are basically teaching our patients and ourselves how to further progress ourselves and or them into the next sequence. Each time that one extremity or device becomes an easier mode of transportation, we want to always progress the patient and go into either crutches, walker, or cane. And eventually you'll even want to change those bilateral crutches into unilateral crutches, so that way that patient becomes further independent and they lean off of using the assisted device. Without further ado.
Hi, my name is Manjot, and I'll be talking about the 3-point gait, more specifically the non-weight bearing. So for this one, as you can see, we have a red TheraBand on our patient, which is Daniel. So again, non-weight bearing, so no weight on this leg at all. And then before you start any of this, you want to make sure you have a gait belt on your patient, so you can, for their safety and for your own. And so what we're gonna do is I'll kind of show it to him first. Is what we're gonna do is also you have one leg off the ground, and what we're gonna have you do is move your crutches ahead, and then you're gonna do a step 2, but it's gonna look more like a hop. So it'll be here, and you're just gonna, and it will repeat that those steps. Okay. All right. So I'll hold on to my patient right here. Make sure you're on the affected side, and we'll go ahead and start. Go through this line. Good. So that was 3-point gait, non-weight bearing, and this one was the crutches. And we are also able to do this with a front-wheeled walker. So I'll go ahead and take these, and I'll bring in the walker. Pause. All right, and then, so a couple of things I forgot to mention with the 3-point gait. So this one is going to be less stable compared to the second, to the 2-point and the 4-point gait, but it does allow for your patient to rapidly ambulate. And the 3-point gait requires good upper extremity strength in both upper extremities and one lower extremity. So that's gonna be one of the main differences between 2-point and a 2 and 4-point gait and a 3-point gait. All right, and then we're gonna have same thing with the walker. What we'll do is we're gonna have you move the walker in front, and then that step 2, we're gonna go here, and we'll do a couple of these. Any questions? No. All right, let's start. Let's go to this line right here. Good. One more time. All right, so that was your 3-point gait with 2 crutches or a front-wheeled walker. Another important thing to know about 3-point gait is the 3-point gait does require a lot of energy for your patient. So if they want to reduce their the amount of energy they're expending, you're gonna want to have them do a step 2 gait pattern compared to a step 3.
Hello, today we'll be talking about a modified 3-point gait. And first of all, I want to introduce my patient. It's Yesenia. And my name is Hadar Al-Hassan. I'm a physical therapist assistant student. And first of all, we do want to talk about her affected foot. Her affected foot is partially weight bearing. It is 50% of her weight. How we measure like the max that she could the max pressure she could put on her foot is by, you could go ahead and step on the scale.
Okay.
And like you could with both legs. Okay, so my patient weighs, without the crutches please, with the crutches in. Okay, so her patient my patient weighs 132 pounds. So half of that is 66 pounds. Go ahead and step back, and then put your foot right here. And when she's stepping, go ahead. As you can see, it's always less than 66. Okay? All right, go ahead and take a step back. Let me move this out the way. And now my patient is gonna be performing the modified 3-point gait. And she's gonna be doing that by, first of all, you're gonna move the crutches in front of you, and then your weak foot, and then your strong foot, okay? And this is step 2. Go ahead and do it again. There we go, that's step 2. And then now she's gonna be performing step 3, which is a little further. There we go. And then if, go ahead. Okay. And also if my patient were to be less weight bearing, we could do the, I believe it's called touchdown weight bearing, right? Which is she barely taps the floor with her affected foot. Go ahead. There you go. Okay. And one more time. Okay, one more time. All right. As you can see, my patient has very good balance and stability. For that reason, I haven't been holding her gait belt. We've done multiple visits in the past, so I just want to clear that out. All right, so my patient will be performing the same thing, but with a walker this time. Okay, so for this one, for example, let's say that my patient did have poor balance. I would be holding the gait belt from the affected side. Okay, so go ahead and press one. There you go. One more time. There you go. One more time. There you go. All right. One more. Yeah. All right. And that's how you perform the 3-point gait.
Hello, I'm going to demonstrate 2-point gait here with Daniel. And what we're going to talk about is this 2-point gait is going to be full weight bearing or weight bearing as tolerated. So that means he can place both feet on the floor. So he's able to plant both of his feet. So what we're going to do here is, if you can narrow your stance a little bit for me. So you always want to stand on their bad side when you're doing gait. And how he's going to begin, we're always going to try to move the bad leg first. So we're gonna move the bad leg and the left crutch, and he's going to land at the same time. So if you can move your right leg and your left leg, perfect. And then now he's going to move his left crutch, his right crutch and his left leg at the same time. Perfect. And this is what is called a step 2. So if they have less balance, they can start doing step 2, and then we can start. Go ahead, yeah. It's always going to be the opposite. So he's going to move the bad leg with the left crutch, and then the right crutch with his left leg, and then you can relax. And then if they can now progress. So what we're going to do now is a step through, which is basically just a larger step. So what we're going to do here is the same pattern, but you're going to take a little bigger and actually pass the crutch this time. So let's take it slow so they can understand. You're going to land the left crutch and the bad right leg at the same time, and then the right crutch and the left leg at the same time. And let's take a few steps. And you can also use a bilateral cane as well, but we're demonstrating with the crutches. And yeah, that's the 2-point gait pattern. And then we're gonna go on to the next one.
Hi, I'm Emily, and this is my patient, Yesenia. I am a physical therapy assistant student, and I'm going to be going over a 4-point gait pattern. This can also be referred to as a spider walk, and you'll see why in just a second. Before you do anything though, you always want to make sure that your patient has a gait belt on, and you always want to make sure as a clinician that you're on their affected side just in case anything happens. If you've worked with the patient before and you know that their balance is pretty good, you don't necessarily have to be holding onto the gait belt, but it's always best to just be holding onto it just for patient safety and to make sure that if they do fall or if they trip over something, you're right there holding them. So like I said, we're going to be going over a 4-point gait pattern, or also known as a spider walk. This is going to be a slower movement, and this is intentionally a slower movement. This is for patients who are full weight bearing or weight bearing as tolerated, but like I said, it's intentionally just supposed to be a little slower just to get them back into walking. This is probably one of the most stable gait patterns just because you're breaking up the segments, unlike 2-point or 3-point where you're having multiple things move at once, such as a 2 gait or a 3 gait where you're having both crutches go at the same time. This one's going to be broken up a lot further. So the first thing I'm going to have Yesenia do is I'm going to have her put her right crutch forward, and then I'm going to have her put her left foot forward, and then, oh, that is your left crutch, I'm sorry, I think I said right. And then you're going to put this crutch forward, and then the remaining foot forward. And that's going to be your 4-point gait pattern. We're going to try that one more time, very slow. So, yep, left crutch, right foot, right crutch, left foot. One more time. And we're going to go to this line right here. So as you can see, that's why this is the most stable, and she's going very slow with it. This is also why it's called a spider walk. So right now what she's performing is a step 2 gait. Her foot is coming in line with the crutches. This is where a lot of patients are going to be, especially when they first start doing gait. They're most likely not going to be able to take very big steps or to follow through past the crutches very far. Once you've gone through a few sessions and you've worked with them a little bit more and they've gotten used to that movement, you are most likely going to start seeing a step through pattern. The way that's going to work is I'm going to have her bring her left crutch forward, except this time instead of meeting her foot with the crutch, which is our step 2 pattern, it's going to go past the crutch. Yep, and then that crutch, and we're going to go past. So as you can see, her foot is now going past the crutch. This is just showing progression, letting me know that she can probably now move on to a different type of gait pattern, or maybe she's just getting better at her walking. I'll have you come to about my foot. And then as you can see, she's kind of like stopping. So I'll have you stop right there. She's kind of doing this motion where she's stopping at the crutch. That is also just a sign that maybe she just needs a little bit more work with her gait pattern. Once they do start to progress a little bit more with their gait pattern, instead of them meeting right here and meeting their feet, you might start to see them actually just going with the motion of regular walking. So I'm gonna have you put that crutch out, this foot, that crutch, and then instead of meeting, just follow through. Yep, and then that crutch, that foot, this crutch, follow through. That is also another way of showing that my patient is progressing, and we could probably either move on to a different gait pattern or just add some more weight to her affected side. And then once again, depending on your patient, you can either follow them very closely, or you're gonna have your hand hooked on the underside of their gait belt just to hold them, especially as they're just starting out with gait training. You want to make sure that you're holding on to them. Because this is just demonstration, I know that she can do it. I was just following very closely, but you always want to start, especially a new patient, you always want to start by holding their gait belt. And that's going to be a regular 4-point gait pattern.
Hello, my name is Yesenia, and that basically concludes our gait pattern video. Don't forget to apply the gait belt on the patient before working with them. And remember that each gait pattern is based on the patient's weight bearing status and stability. And in order for us to help that patient move safely and effectively, we must follow the correct sequence. Thank you for watching.